Good afternoon, everyone. I'm Dr. Meghna. My paper topic is histopathological study of lacrimal sac in cases of chronic dacryocystitis. As already described, diseases of lacrimal drainage system account for nearly 3% of visits to eye clinic, and among them, chronic dacryocystitis is the most common one. It can be acute or chronic. Chronic is more common than the acute form, and it is usually associated with obstruction of nasolacrimal duct. It may be idiopathic or secondary to various infections, inflammations, or injuries, or even neoplasms. The aim of my study is to evaluate the histopathology of specimens obtained after DCT and to score the chronic inflammation. My study design is a prospective observational study. It is done in about 10 patients in a period of 2 months at Sarojini Devi Eye Hospital. My inclusion criteria is patients with chronic dacryocystitis of all ages and both genders. Exclusion criteria are recurrent cases with previous history of DCT done. The procedure, a thorough preoperative ophthalmic checkup was undertaken for all the patients to rule out any other abnormalities. Then the lacrimal drainage system was assessed by means of syringing and probing to confirm nasolacrimal duct obstruction. Then DCT was done and the specimens of lacrimal sac were collected and sent for histopathological examination in 10% neutral buffered formalin. There the slides were examined. They're appropriately processed for paraffin blocks and stained with HND stain. They were examined for the chronic inflammatory cell infiltration, fibrosis, and capillary proliferation, and whenever present, they were graded according to severity. This gradation was done using the same scheme as AMIN-RM. So here we will be dividing it into mild, moderate, and severe, and each entity, inflammatory cell infiltrate, fibrosis, and capillary proliferation, they're graded according to the number of cells or the percentage of fibrosis or the number of capillaries we see per one high power field. And then a chronic inflammation score ranging between 3 and 9 was recorded for each case after adding the individual scores for each of these histopathologic features. This final score was used to categorize each case as mild, moderate, and severe. The results, age distribution in the study population, majority of my patients belong to 50 to 60 years age group, and gender distribution, majority of the patients were females. The patients, about 50% of the patients came with the signs of mucopurulent discharge, and 40% of the patients with epiphora with clear fluid, and then one patient we got with the mucocele. These are the sections showing epithelium lined by pseudostratified columnar epithelium with goblet cells, and subepithelium showing lymphocytes and plasma cells infiltration and some destroyed capillaries. Very few slides have fibrosis in our cases. These are my histopathologic findings which will be discussed. Chronic inflammatory cell infiltration was found to be mild in 2 cases, moderate in 5, and severe in 3 cases. Only mild fibrosis was observed in half of the collected specimens. Severe grade of capillary proliferation was found in 2 cases. Diffuse chronic inflammation with marked vascular proliferation was noted in some of those cases. So basically the chronic inflammation score was calculated in each case, and it revealed that 30% cases belonged to the mild group, 50% to the moderate group, and 20% to the severe category. Chronic dacryocystitis is mostly associated with non-specific chronic inflammation. Specific pathologies, both inflammatory and neoplastic, have been reported in 0 to 14.3% cases in previous studies. But our study has a very limited number of cases and done under a relatively shorter time period. So incidence of neoplastic changes or granulomatous changes was not seen. Anderson et al. And other studies highlighted that even though most lacrimal sac biopsies reveal non-specific chronic inflammation, routine biopsies must always be undertaken to rule out any specific pathologies and also for understanding of various diseases of lacrimal system. To conclude, we recommend that chronic inflammation score must be included in the histological evaluation of specimens obtained by DCT. Since greater degree of inflammation is associated with a poor and delayed rehabilitation post-surgery, this score would help clinicians to monitor the dose and duration of therapy with NSAIDs. Also, malignant or systemic disease in patients with neither specific history nor clinical or radiological findings might be observed, so it is better to take a histopathological examination also. Thus, we recommend taking biopsy if any suspicion is there. These are my references. Thank you.
Thank you, Dr. Meghna. One question, have we compared any change in the histopathology with the age?
No, sir, I haven't compared. I should have. We haven't compared with age. I should have.
Any question from chairperson, sir?
Explore the tumor, and in next study you can tell your histopathologist to grade
Yes, sir.
the grade of what are the grades of inflammation, what are the things, infiltration, etc. So we can tell, and you can support it all, is a Roplus positive or negative, clear fluid or what, purulent, and we can compare with the organism also.
Yes, sir.
The inflammatory pattern depends along the organism. Suppose if organism is very virulent and it is like a pseudomonas, etc. In such cases, always you can compare with the your organism.
Yes.
You can support the organism. That ideally it should be along the culture sensitivity pattern.
Yes.
If you can compare, then there will be more results.
Yes, sir.
Here only you can say it is a tumor or not tumor.
Actually, my research was cut short because our septic OT got closed, sir. But I'm still continuing after the renovation. Then I would definitely do this correlation with micro.
Not along with your, as your other one word septic OT.
Yeah.
None of the OT is septic.
We.
If it is a minor OT and septic OT, it should be eliminated from our mind. All of this, even if we do a culture, sometimes there is a cataract, there is an organism. But I am working in both acoustic cataract as well as in the DCR OTs or other OTs. But in surprisingly, in DCR OTs, there has been the basic level of organisms. So there is none of the OT is septic. This is our misconception. Okay. Please request everyone. So DCR is not done in a septic OT. It is in a number of the OT. It may be one number or two number or three number. None it is a minor OT, nor it is a septic OT.
Okay, sir. Thank you.
So that are some.
Okay, thank you everyone.